Ahmed Ogwell Ouma, the Acting Director, Africa CDC. Welcome, sir.
No, thank you, John, and sorry for that mix-up that our presence wasn't appropriately announced. But I would like to start with an African proverb. No, not proverb really, but a writing from one of our more prominent writers, Chinua Achebe from Nigeria. Good to see you, Honorable Minister. And he says that when we invite our kinsmen for a party, it is not because they are starving, because everybody can eat food in their own homes. Indeed, when we gather in the village square and we want to watch the moon, it's not because we can't see the moon from our own homes. It is because it is good to come together. And today, it is really good to come together to speak about how to eliminate hepatitis from the world. As Africa CDC, we are committed to ensuring that we support all our countries on the continent to be part of this very great effort of bringing elimination of hepatitis to reality. And it is possible, and we are very proud that one of the leaders of elimination of hepatitis in the world is an African country. It is not by mistake that Egypt is doing what it is doing at the pace it is doing it. It is not by mistake that Africa is leading in this particular area, but it is precisely because Egypt took it as a priority, and the president put his name behind this particular effort. Africa and its priorities, when we focus on them, we deliver, and we deliver well. Africa CDC is one such institution that has been put in place by our heads of states to lead the prevention and control of disease on the continent. And we are willing, able, and are here to be part of this friendship circle, not because we cannot be able to do what we do when we are back in Africa, but it is because it is good for all of us to come together and aim for that one goal of eliminating hepatitis in this world. Finally is to share just a little of what we are doing as Africa CDC on the continent in as far as hepatitis is concerned. Africa CDC is just about 5.5 years old, but we are punching way above much older institutions and organizations, much older countries. And we are doing that because we've been given very clear instructions by our principals. We have been provided the opportunity of being able to address the challenges on the African continent, and we do it through the new public health order. And I'll speak about one pillar of that new public health order. It has 5. That one pillar is partnerships. We are convinced, after the experiences we have undergone during this pandemic, the COVID one, that we need to do things on our own as Africa. But that doesn't mean that we'll do it alone. But we must be the ones to set the priorities and adapt whatever tools, strategies there are to the continent. And we are convinced that we can only be able to do that if we, as Africa, our governments particularly, take the center stage in the leadership to be able to guide the strategies that are required to prevent, control all types of diseases, in this case, hepatitis. And I am confident that the path that we have taken as a continent will result in elimination of hepatitis and will result in the control and prevention of the myriad of diseases that bedevil this world. Indeed, we intend as Africa to lead not just in hepatitis elimination and prevention, but in health security in general. And you, as friends, we will be inviting you to the African continent so that we can be able to enjoy the sight of the moon and also have a meal together around the village square. Thank you.